Hi there, Dr. Tansavatdi here. So as promised, I talked to you in a previous video about the shopping list that I'm going to provide you via video of what you need to purchase to prepare for your CO2 laser resurfacing procedure coming up. So the first one is a big jar of Aquaphor. I talked about it in another video. You may need a second one. I don't have stock in Aquaphor, but I wish I did. But you are going to need a big jar of this. Some people do have an allergic reaction to wool, so that's very rare. I've only seen it once, and one of the products in this is called lanolin, and if you have a cross-reactivity where you're very allergic to wool and you can't wear any wool products, then we might have to switch you to a different product, which is called Eucerin, or another one, which is our CeraVe. Sorry. Cetaphil also makes a moisturizer as well. Those are not as thick. So this is a thicker product, and then even a thicker product than this is called Eucerin, E-U-C-E-R-I-N. But the go-to is always this. This is the gold standard, what I would use for after the procedure, and that's what you should use unless you have explicitly told me that you have a sensitivity to wool. The other thing you're going to want is a baby washcloth. This is a regular washcloth, but the baby washcloth side, which I don't have here to show you, but you can find that at the store. They're thinner, and they can be used to wring out the dilute vinegar soaks. You're also going to want to make sure you have ice in the freezer. You're going to want to get a bottle of distilled white vinegar from the store, and you're going to want to get some tongue blades or popsicle sticks, easy to scoop up. You could also get just a regular spoon and just wash it every time. One of the things that's helpful is to take the Aquaphor and put it in a small little cup and put it in the microwave and heat it for about 10 seconds to warm it up a little bit so it matches your heat, the temperature on your skin, because what happens is if you put it directly on, it will just be thick and stick to the skin, and it will want to peel away your skin. So the more you can warm this up before you put it on the skin, it will go much smoother. So after the procedure, one of the things that we want to let you know is when you can start to use certain skincare products. I won't give you that go-ahead until I'm feeling that it's safe to do so. You'll know when all of your skin has returned with this deep pink skin color without any of the crusting. When it's all gone and it's all clean new skin, then that's probably when I'm going to give you the go-ahead to switch on over to a thinner moisturizer. So this one's pretty thick. There's another one from Ulta MD, which we carry here. It's an Ulta MD moisturizer, and it's a thinner product, but it's also a little sticky. I like to use that as a go-to during the day or at night. You can use a thinner product during the day if you need to, and that would be your CeraVe or Cetaphil moisturizer. Those products can be a little bit they're not as sticky, they're not an ointment, so they're more of like a cream, so that can go on a little bit easier. You can also look for a gentle moisturizer over the counter. If you have one that you're currently using and you don't have any problems with that, you could go ahead and use that too, start resuming your skincare regimen. But please feel free to show me your products before the procedure so I can look at the list of ingredients. Sometimes in the ingredients we'll find something that can be irritating after the procedure to that fresh new skin. I do recommend Cetaphil as a wash after the procedure as well, once all the new skin is in and after the vinegar soaks are done. So that would usually be around 7 to 10 days is when you'll now switch to a gentle cleanser. You want to use a cleanser that's not going to be ripping on the surface of the skin, so no scrubs, and you don't want anything with a lot of acid, so no lactic acid, glycolic acid. You don't want a very gentle gentle face wash that's moisturizing. All right, then the other thing I want to talk about is sunscreen. Sunscreen options, I always like that you use a sunscreen that has physical barriers. That includes zinc oxide and titanium dioxide. There's several different options on the market. The ones that I like are organic, and that would be Badger. There's another one that's called Australian Gold. Look in the children's section as well for more sensitive options, because your skin's going to be sensitive after CO2 laser. We also have a sunscreen in our line, my line. I have a sunscreen option as well, and that is great to use for the face. It's specifically designed for the face, and it has a tint to it to help block out more UV rays. Then in terms of makeup options, these are things to possibly test before your procedure, because it's harder after, once you've got given the green light to start applying makeup, to start trying out different makeup products. But one of the makeup lines that I prefer is It Cosmetics, because it has specifically designed for those patients who have rosacea, which is this redness in the skin. You can look at It Cosmetics. Another option is Oxygenetics, and Oxygenetics is meant to be breathable, so it's meant for post-CO2 laser resurfacing, specifically designed for that. It is a little more pricey, and you will have to find some place that carries it, because it's not in your normal stores like Sephora and things like that. The other option is using Cicapair, which is also can be found at Sephora, and it is a base, so it has a green tint to it, and you apply on the surface, and then you can apply your own makeup over. The last thing I forgot to mention was the importance of possibly getting an antihistamine for after the procedure, because you may have some itching, and that can last a few days. So Benadryl is a great option over the counter, and I would avoid using it during the day. Use it closer to the nighttime, so that can help you go to sleep as well. So hopefully this list for you helped. There's, besides about the tongue blade, I had one other thing I wanted to talk about, which is getting some extra strength Tylenol for pain if you need it. Also, Hibiclens will be providing to you. Hibiclens is a face wash that we need you to do the day of the procedure, that morning of, as well as vitamins, arnica and bromelain, which we'll be providing for you too as well. And we'll give you those instructions at your preoperative appointment. Or in a previous video, I probably talked about that as well. All right. Thank you for tuning in.